Results I've never seen before in my practice and were exciting to say the least.
I used to have to sleep 2-3 times a day. Now often I can get up early in the morning and work all day without taking a nap.
I was always in bed by 9. 8:30, 9 o'clock I was wiped out. And I just accepted that that was due to I was so anemic. But it would be 11, 11:30, 12, and I was still up cleaning or doing whatever I wanted to do, and I had all this energy. And that's when it hit me that something's different.
All these things, all these symptoms that I was beginning to believe I had to become accustomed to started to subside. And I started getting a sense of hope again. And I started thinking, okay, I might actually have a life to live.
I feel younger than I was at age 69, and I'll be 79 in a matter of days. And I started a new business. Robert was age 60 and I was age 78. We became partners in this new business. Robert had a very serious back condition, and I introduced him to the glyconutritional program.
I couldn't sit up in bed. It was just starting to become just a steady agony. The MRI showed that I was suffering from spinal degeneration. They told me that I was going to be in a wheelchair before very long and that I probably wouldn't walk the rest of my life. You just feel like that's just about the end of your life. I mean, it's tough. Eldor suggested that I try these glyconutrients. I noticed things began to happen almost immediately. It was going into my 4th month, and all of a sudden I could tell things were happening in my back. I got a little relief one day, and I got a little relief another day. One morning I got awake, and like always, my first move was to sit up, and that morning I sat up in bed. And I looked around and I realized that I was sitting up and I wasn't in pain. And I was so elated. I just screamed and I jumped right out of bed. That's how I got out of bed the first morning. And that was the first morning for years that I got out of bed with no pain.
I started to recommend the glyconutrients to patients with long-term chronic illnesses. And within a couple of months, we started to see results that I've never seen before in my practice. I saw lab work change, I saw symptoms get relieved, I saw areas of degeneration starting to improve.
I was in the vaccine study for HIV. I told them that I had this really bad flu, and they said, let's test you right now. So they tested me, and sure enough, I tested positive. And within 2 years, my T cells went from a normal 500 to 190. And my viral load went from 0 to 157,000. Doug told me about glyconutrients and about testimonials that he had had. So I started taking glyconutrients. The next test, my T cells came up, only 5, but they came up to 195 and the viral load came down. So I started bulking up on it and taking more of it. And the next test, the T cells came up more significantly and the viral load came down. And then the last time I was tested, the T cells had gone up to 244 and the viral load had gone down to 42,000, which is really, really good. At that point, my doctor asked me, what the supplement I was taking, and I said glyconutrients, and for the first time he wrote it down.
When I was in medical school, we received a 1-hour lecture on nutrition. That's it. That was the extent of the education. So I think that sums up the attitude that physicians have about nutrition. It's for people who aren't smart enough to get into medical school. And I'll just quite honestly tell you, that's exactly what I thought. If I was that dumb, I would have gone and been a nutritionist. Yet nutrition is an amazing science. It, in fact, is biochemistry.
I believe somewhere in the next 10 to 20 years that this will be in the curriculum of all training because it gets results.
Researchers are studying the effects of this on allergies, depression, degenerative diseases, even cancer.
At this point, we have over 45 gene defects that there have been reports of major benefits.
I have a lot of autoimmune patients who are absolutely helped by glyconutrient and vitamin mineral therapy.
We see a very high response in ADD, ADHD. The thing that hits me the most is the effect these have on children. The younger you can get children started, on the micronutrients, the better they respond.
Since she was 3, my daughter Sarah was getting chronic urinary tract infections. The bladder was very swollen and inflamed. I wanted to know what was causing it, why it was happening, and the doctor said they don't know why it happens. They kept putting her on these antibiotics. They kept her from getting an infection, but I was looking for something that could help her to heal. I had just gotten to my wit's end with this. I've been dealing with it for years. She was sitting under the table, her face bright red in pain. It's horrible to see your child go through that. When Sarah was 7, we decided that we would try the glyconutrients, and within 2 weeks, we noticed a difference. After 3 weeks, I asked her, I'm like, do you notice a difference? And she was like, oh yeah. Doesn't hurt anymore when I have to go to the bathroom. I don't have to run to go to the bathroom.
That was a big thing, knowing that she was getting some relief after how many years. To us, that was an indicator that whatever is going on, whatever these glyconutrients have, they're giving her body a chance to regroup.
For the first time, I really feel like she's healing. And she must be, because she hasn't been on antibiotics going on a year. And she hasn't had an infection at all for the first time since she was 3.
Luke, our oldest son, was having seizures. And along with the seizure, he was struggling somewhat with depression.
We took him for some neurological testings. After doing MRI and EEGs, they said that he had epilepsy. Each month, it progressively got more intense and more frequent. We were at the point where we had to do something. We were really considering putting him on a medication.
All of them had pretty significant side effects.
A lot of the anti-seizure medication has depression as a side effect, and he was already depressed, and I didn't want a child on my hands who wasn't having seizures but that was suicidal. I mean, what did I gain there?
That was pretty much at that time that we had gone to a seminar and heard Dr. Reg McDaniel. My wife and I had a chance to talk to him afterwards.
The next morning I started him taking the glyconutrients.
We saw, in a sense, an immediate improvement. He started becoming the kid that we remember growing up. A much happier kid.
We're not dealing with the depression anymore at all. He's a different kid. He's playing well, he's making friends, he's much happier. He's got a light in his eyes and a smile on his face, and he's now been 6 months without a seizure.
That was all we needed. Just to have the seizure stop was enough. But to see him becoming a much happier kid, not struggling with the depression, that was a big thing.
My husband has definitely seen improvement in his health.
10 years ago, the doctors determined that I had high blood pressure, so the doctor got me on some blood pressure medicine. And I've pretty much been on that for the past 10 years. When we started taking the glyconutrients, maybe 2 months went by, and sure enough, my blood pressure had come down significantly, and so we cut the medication in half. Hopefully within another month or 2, I'll be off the blood pressure medicine altogether.
My husband has had a problem with allergies since he was a kid. He would have to wear a white mask when he would mow the lawn.
The symptoms I pretty much began to disappear because it was maybe 2 months later that I realized I was out cutting the grass and I was having no reactions. I think we're all accustomed to only seeing that kind of result through medication. To see it take place through just nutritional supplementation, that was pretty significant.
I, as a physician, am real excited about that. And I think that physicians in general should be fascinated from a scientific standpoint.
If medicine doesn't know what causes this condition, if medicine has no treatment, if the treatment medicine offers eventually gets worse than the original disease, that's where these micronutrients excel.
When you improve somebody's quality of life, they're living, as opposed to sort of being the living dead. And it's wonderful. It's very rewarding.
After seeing so many dramatic results with the people that I've recommended this to, my approach to healthcare has changed fundamentally. If you find out what the body needs and then feed the body a nutrient-dense supplement and then allow the body to do what it was designed to do, which is to heal.